Good afternoon. Hello, everyone. Good afternoon. As you come into the live chat room, please feel free to type your name into the chat area and and like and share. Thank you for being here this afternoon. Hello, everyone. Thank you for joining. So, in just another minute, we're going to be starting today's chat. We're going to be talking about a really a timely topic. I've had a lot of people reach out with questions about some of the things that we've seen happen over the last week. Hi, Chandra. Thank you so much for joining. I appreciate you being here. Thank you. So everyone, as you come in, please like and share in case there are others who might find this information helpful. Please like and share as you come into the chat. Thank you again for being here. Hey, Pamela. Hey, Melanie. Thank you both for being here. I appreciate y'all. We're going to get started in just another few seconds. Today, we're going to be talking about the recent changes at the Supreme Court level and what that might mean for us in terms of birth control access. Okay, so thank you for being here. As you come into the live chat, please like and share in case you have others who might find this information helpful. Okay, so let me just adjust this. Can you guys hear me okay? Okay. Awesome, awesome. All right. Excellent. So let's go ahead and get started. Um, whenever we do this Sunday chat at about 4 p.m., I always promise you guys to not take too much of your time. I know we all have so much going on, but I appreciate you all being here. So today we're going to be talking about the new Supreme Court and what implications that might have for all of our birth control access. Okay, and there are three important things that I want you guys to know. So let me start with a formal introduction. So I am Dr. Madeline, your board certified OBGYN, international speaker, and published author. I help busy women, whether they're busy outside of the home or inside of the home, access the GYN care and birth control information that they need so that they can have the most control and freedom over their lives so that things are not too hectic. By helping them, again, I help them access what they need so that everything can be a little bit more organized in terms of their space and what they're trying to get done. So please follow me on Instagram, Facebook, and Twitter at Dr. Madeline MD. That's DrMadeline, Okay? So again, thank you all for being here. So let's go ahead and get started. So this is a topic that I think is very timely. Again, I've had a few people reach out to me and ask me about the different things that are going on in terms of birth control. So as you saw this week, there was a Supreme Court nominee who was confirmed, and so we now are back to 9 Supreme Court justices. The really important part for us to keep in mind is that the one who was confirmed now gives the Supreme Court a 6-3 majority, and that majority is definitely leaning toward the conservative side. Now, this Supreme Court new justice confirmation makes those of us who do women's health a little bit concerned because, as you know, we've had certain laws in place and certain freedoms in place for many years. When you talk about Roe versus Wade, that's the landmark case that made abortion legal in the United States. That was approved in 1973. And so we've had different challenges along the way. There have been states that have tried to challenge the federal law as it stands. And one of the things that has people concerned is, what's going to happen now that we have this court that is leaning so far on the conservative side. And that's certainly a real concern. From what we know right now, and this is one of the three things that I want you guys to know. So This first thing is that this is the first time in decades that we've had a Supreme Court leaning this way. And when we look at what we think might happen, it's important to know that cases could be reaching the Supreme Court very soon. So, what does that mean? So, we have this 6-3 Supreme Court majority that is more conservative. We have one case that was filed by Mississippi. In fact, it was refiled as soon as they saw that the Supreme Court justice was likely going to go forward. And this situation in Mississippi is challenging the performance of abortions after 15 weeks of gestation. Okay? And so, hey, Cheryl, thank you so much for being here. I appreciate you. And so, this Mississippi challenge is probably going to reach the Supreme Court in the coming weeks. So, the first question is whether or not the Supreme Court is going to choose to hear the case. Okay? If the Supreme Court chooses to hear the case, especially with this new 6-4 lean, again, many of us who work in women's health are concerned about that. What will happen if the Supreme Court hears it and if they rule in a way that does not uphold Roe v. Wade, which basically made abortion legal up to about 24 weeks, which is when viability is, and this case in Mississippi is challenging that up to 15 weeks. And so, I think one of the things that I want you guys to know is that as these things are happening in the news, it's important that we at least keep them on our radar because they might signal how we need to be ready to move forward. Okay? So that's the first thing I want you to know is that we're in a new space with this 6-3 Supreme Court, and that there can be a case possibly in as soon as a few weeks based on this Mississippi challenge that is challenging abortions beyond 15 weeks. So the second thing I want you to know, and I've said this statistic before, but I think it's really important, and I want to underscore this because, again, with the new Supreme Court and everything, we're going to possibly have to shift how we think about things. So the second thing I want you to know is that nationally, about half of all pregnancies in this country are unplanned. Okay? And so what does that mean? That means that, for many women, they might get pregnant. If it's unplanned and still wanted, that's great, right? Because then there's no problem. Many happy pregnancies go toward completion, and they may have been unplanned, but it doesn't mean that the woman doesn't desire to keep the pregnancy, and it doesn't mean that that woman and or partner is not going to love that child and raise it and just give it everything they have. But there are many women for whom pregnancies are unplanned that have to think about what is going to happen or what they're going to do in terms of whether they want to end the pregnancy, whether they want to try to continue, whether they want to give the pregnancy up for adoption. And so it's important to think about that 50% of pregnancies being unplanned because it's going to lead to the third thing that I want you guys to know, and that is we have to become more intentional about our birth control. Okay? When you look at what's happened at the Supreme Court, and when you look at the fact that about 50% of all pregnancies in this country are unplanned, it means that, especially if the court leans in a certain way, it means that we're going to have to be much more intentional about our birth control. Birth control is important for anyone who, for women, after we have that first period, which for a lot of girls can be as early as age 11 or 12, if they're sexually active. Many women don't become sexually active until later in their teens. And then until a woman has menopause, which the average age in this country is 51. And so that's many years for a woman to have an unplanned pregnancy. And so one of the things that really I think on both sides of the aisle, both Republicans and Democrats agree, it would be helpful to have more access to birth control so that unplanned pregnancies decrease. Okay? That's something that we all agree on. We don't agree on how to get to that place of getting women more access to birth control. But we absolutely agree that that's something, well, most of us agree that that's something that would be helpful for women and definitely helpful to decrease unplanned pregnancies. And so when I talk to you about being intentional about your birth control, what that means is that if you are in that window of having your monthly cycle, if you know that you are in a medical space where you are ovulating like most women do every month, and you're sexually active, if you have a partner who is of the opposite sex and that partner has sperm and it can potentially meet your egg, if you are in that window, Being intentional about your birth control means that if you are not prepared to have a pregnancy and possibly carry it to term, then I really want you to think hard about your birth control options. There are many options out there for women to consider. One of the most popular forms of birth control is the birth control pill. Definitely when you talk with your provider, when you go over your different medical diagnoses, figure out if there's a birth control pill that would work for you. Birth control pills come in a range of formulations. Some of them have both estrogen and progestin. Some of them have only progestin. If you're a woman who has elevated blood pressure, high blood pressure, hypertension, the birth control pill with the two hormones is not what we're going to recommend for you because that can increase your risk of other things. But there are so many birth control options out there for you, and I want again for you to begin thinking about being intentional about those birth control options. Another group of birth control options that I think are important to know about, especially if you're in a place where, let's say, you're looking at your current situation and you're thinking, I don't think I want to have a child for 3, 5, or 10 years. We have something that we call LARCs, or long acting reversible contraception. What those LARCs do is they give you years worth of birth control. Okay, two types of birth control are LARCs, are long acting reversible contraceptives. They are IUDs, or intrauterine devices, and the other type of LARC is an implant. Okay, so we've talked a little bit about these in another Sunday chat session, but I just want to go over them again quickly because, again, I've been saying it so far a few times in this chat. With what's going on at the Supreme Court level, we're probably going to have to be more intentional about our birth control, especially in certain states. Like I said, Mississippi is already challenging, trying to bring to the Supreme Court a challenge. So when I say LARCs, and when you think about whether or not having years worth of birth control is something that would work for you, I definitely want you to think about an IUD, an intrauterine device, or an implant in your arm. So when you get an IUD, it's a little plastic device that is maybe about this big, maybe smaller. And what happens is there are a couple of types. One has some hormones already in it, a progestin type of hormone, and that IUD can go into your uterus. What happens is when we insert it into your uterus, we cut the string a little bit out of your cervix so that when it's time to come out, we just grab that string and we pull it out. Okay, that IUD that has some hormones in it is really good, particularly for women who might want to slow down their period if they have periods that are very heavy. That IUD that has hormones in it is also good for decreasing the amount of blood flow that a woman might have. That IUD can also decrease some of the pain. If a woman has a very painful menstrual cycle, having that IUD can really be helpful for her. The other type of IUD is one that doesn't have any hormones in it. That one is called a copper IUD. The only one on the market in the U.S. is called a Paragard. Now that one is great. That one can stay in place. It's FDA approved to stay in place for 10 years. But some people will keep it an extra 2 years and it still works. It still prevents pregnancy very well if you happen to keep it in for those extra 2 years. So you can have that copper IUD in place for up to 12 years. Women, again, who have different medical things going on, if it would not be a good idea for them to have any hormones in their system, then that copper IUD works great. Okay? Now, what I didn't say about the hormonal IUD, most of the ones that we have on the market in the U.S. these days, they can be in your uterus for as low as 3 years to as long as 7 years. So they work really well as too in terms of long-acting reversible contraception. Okay, so that's certainly something to think about. Um, so again, the pill is the most popular. LARCs are increasingly popular because they give women years worth of birth control to think about. Some women, if they're at the end of their childbearing years, some women would rather just have their tubes tied, which means that that's permanent sterilization. Sometimes I have people ask, doc, I'm thinking about getting my tubes tied. Do you think if I change my mind in the future, can I get them untied? And I definitely want you to know that that's not how I want you to think about getting your tubes tied. Getting your tubes tied, whether it's the woman getting her fallopian tubes tied or whether it's the man having a vasectomy, I don't want you to think of them as being reversible. Okay, I want you to think of them as permanent sterilization. And that's important because sometimes when people come back and maybe they've changed their mind or they have met a new boo and they are possibly trying to get pregnant again because that new partner doesn't have a child, it's not as easy to do the surgery that would allow someone to try to put tubes together, especially in a woman. It's sometimes a little bit easier in a man if they've had a vasectomy. But in a woman, it's more challenging to do depending on a woman's insurance coverage. Insurance may not pay for it, and it can also be very expensive depending on what's going on. Or if a woman has had her tubes tied and she decides in the future that she wants to have another child for whatever reason, if she still has her uterus, she doesn't have to try to get the tubes put back together. She can consider in vitro fertilization, which, as you guys might know, is when a woman works with a special type of gynecologist who helps her ovaries to get really stimulated, and then they pull eggs from the ovary, and in a lab setting, they put the egg and the sperm together, and they create embryos that way that can then be put back into the woman's uterus. So there are options, but they certainly are complicated, and they can most definitely get expensive. Sorry, y'all. That's my puppy in the background. I guess he's really excited. But so that's definitely something to think about. So let me recap. Oh, hey, Michelle, thank you for joining today. Thank you. I appreciate you being here. So we have a question. So let me just recap the top three things I want you guys to know. So first of all, we have a 6-3 leaning Supreme Court, which could be bad news for women's health. We anticipate it's going to be bad news. So that's why I want you to remember the second thing. The second thing is that half of all pregnancies in this country are unplanned. Between 45 and 50% are unplanned. And maybe unplanned is not a big deal for some people. For some people, unplanned still goes on to a healthy pregnancy outcome. That's fine. But for those who have unplanned pregnancies, who might need to be aware of all their options, it's going to be more important that we get way more intentional about birth control. Okay? So we have a question here. Michelle says, for menopausal women, would you recommend getting your tubes tied? Oh, that's a great question, Michelle. So, the reason that women get their tubes tied would be to, usually it's to prevent an unwanted pregnancy. However, hey, Janet, thank you for joining. However, if a woman is truly menopausal, and I say truly because sometimes the body may not be fully there even if she's not seeing her cycle. But if a woman has truly gone through menopause, if she's had 12 months of not having her period, then her hormones should be at a place where she cannot get pregnant. And so if a woman is all the way in menopause and she verifies that she can't get pregnant, then for that woman to tie her tubes would not necessarily help her goal if the goal is to decrease the chance of an unplanned pregnancy. Does that make sense, Michelle? There are some women who, like, let's say if a woman is menopausal and she has a cyst on her ovary, or something like that. There are cases like that where if a woman has a cyst in her ovaries and she's menopausal, if we were to go in and do surgery to remove those cysts, then a lot of times we would remove the fallopian tubes as well. That is one scenario in which that might be the case. But if a woman is truly menopausal, and the other reason that's a great question, Michelle, is because for many women, menopause kind of doesn't happen the way we would expect. So I have many patients who'll say, oh, I haven't had a period for 9 months, and then at month 10, I had a cycle. Does that mean I'm in menopause? And, it's a great question because it means that they are not yet in menopause. The official definition of menopause is 12 months without that cycle. And when a woman has had 12 months without that cycle, then she falls into that menopausal category. If she bleeds after that 12 months, that's still something that she should let her doctor or her nurse practitioner or a clinician know about, because it could mean that she has what we call postmenopausal bleeding, and then that has to be evaluated in a different way. So thank you for that question. Great question. Thanks, Janet. Thank you for being here. Hey, Lee. Thank you for being here. And let me see. Okay. Lee says, I had my tubes blowtorched 8,000 years ago. Is there a 100% guarantee that I can't get pregnant? Well, the bad news is that the younger a woman has her tubes tied or blowtorched, as you say, the more years she has for those tubes to try to grow back together. And so, there's no 100% guarantee. Even when we're counseling women who are going to get their tubes tied, and I had a woman, a couple of weeks ago. God bless her. She's on her 13th pregnancy, and she wants to get her tubes tied. Again, God bless her. But so when we're counseling them, we always let them know that there's a small chance of that tubal ligation not being successful. So many times it's less than 1 in 1,000. But the reason it's important is because let's say a woman has had her tubes tied, whether she's 24 or if she's 38. If she's had her tubes tied and she still should be getting her monthly cycle, if for some reason her cycle doesn't come, it's very, very important that she check a pregnancy test to know whether or not she somehow got pregnant, even with that tubal ligation. One of the things to keep in mind is that different OBGYN practitioners tie tubes differently. So, my surgical process is to tie, cut, and burn the ends of the tube to really try to make sure they are far apart and they can't grow back together. There are some who use what we call a Filshie clip, and that little clip just goes on the fallopian tube to try to crush the tissue, and that's a smaller area that's blocked on that tube. So, it's important to know what type of procedure a woman may have had, but again, the younger you are when you've had it done, the more years your body has to try to figure out a way for those tubes to grow back together. So thank you for that question. It's not 100% guarantee, but depending where you are in your process, if you haven't gone through menopause yet, you might want to use a backup method if you're not on birth control already. So, okay. So great. Oh, good. Michelle says she's 12 months free. Hallelujah. I know that's a great feeling. It leads to a different sense of not being as worried about stuff happening when you are done with your cycle. Yes, Janet, that's what I said. 13. Janet says her uterus should be upset with her by now and just give up. Yet, there are some people out there who, God bless them, their bodies, they get it done and they get it done over and over again. But yeah, she was pregnant with her 13th. So, so we'll see. But, she's also interested in permanent sterilization with a tubal ligation. So we will see how that goes. Okay. Well, thanks, guys. Do you have any other questions for me? Okay, awesome. All right, so let's recap today because, again, a lot of times people will say, "Oh, I don't really like discussing politics," but again, this political situation is about to impact women directly, which is why I really wanted to talk about this with all of you today. So again, to recap, the three things that I want you guys to know as it relates to the new Supreme Court and our birth control options is that the first thing is we now have, for the first time in a long time, a 6-3 Supreme Court majority, which is conservative leaning, which means it could have bad implications for us as women and our reproductive health choices and access. One of the other things to keep in mind as we talk about those three things to know is that within the coming weeks, if the Supreme Court decides to hear this case, there's going to be a test case. There's going to be a case out of Mississippi in which they're challenging abortion beyond 15 weeks. There are several other cases scheduled to come behind that after that. But again, we don't know for sure if the Supreme Court is going to choose to hear them all. But I think it's a good idea to keep this Mississippi one on the radar because at a federal level, it could shift how things happen in terms of reproductive health access for for women. The second thing to keep in mind is that nationally, 45 to 50% of pregnancies in this country are unplanned. If that is not a number that you want to be in, the third thing is that I need you to become very, very intentional about your birth control. Know your options, talk with your provider. Those of us who have younger women in our lives, let's make sure that they're on the radar because, I have some patients who don't believe things will change at a Supreme Court level. But, if you were born after 1973 or even, later than that, you've never known an existence where women didn't have access to those things. So, again, we have to, educate our younger sisters, keep them in the loop. Um, Oh, Michelle has a question. To tighten yourself, would you recommend yoni? Yes, that's a great question, Michelle. Those yoni, the balls that can go into your vagina, those work great. They kind of help your body do Kegel exercises, and so those are definitely something that I would recommend for women who are trying to tighten those muscles. You can hold them there in place, and the act of holding those, you know, balls in place can certainly help to tighten the muscle, as well as Kegel exercises that you can do, anywhere. If you happen to be sitting at work, a lot of people are working from home. If you're working from home while you're on your Zoom call, you can do exercises that can tighten your pelvic floor muscles so that you can be be prepared if you need to use those muscles, whether it's for any reason, including sex. A lot of times women will do those exercises after, especially after they've had children, or as they get older and the muscles get more relaxed, because it will help to tighten up, and it can make sex more enjoyable, more pleasurable for the woman